this 55-year-old woman came in with chest pain. And before, in the middle of me taking her history, she just kind of grabbed my hand and said, I know what you're going to tell me. I know what your differential diagnoses are. I just want to tell you it's not my heart. I know that it is. And, as you're taking the history, it's chest pain, sometimes it's exertional. So definitely raised alarm bells. All emergency medicine physicians that do this, we know that when a patient comes in, there's a certain set of criteria that determines which pathway we go. And she said, I know you're going to tell me you're going to have to rule out a heart attack, and I know that's the responsible thing to do, but I know it's not my heart. So, we did through workup. We went through the motions. We did what every EM physician should do, and we essentially ruled out any acute causes. And she was deemed safe to go home based on her risk factors and her heart score. So when I went back in to tell her, "Hey, it's not a heart attack. It's not your heart. Everything looks okay," she didn't seem relieved. It was almost like a knowing, and she just like kept nodding. She said, "I know, I know." I told you, mind over matter. That's what she said. And I looked at her and she said, I need you to hear me because you're going to help so many patients. It's mind over matter. It's been my mantra since I was a kid. My uncle told me this. And every time I come into the hospital for whatever reason, I remind myself it's mind over matter. And, I told her, I support that. I'm glad that you did the mature thing. You did the right thing, which is ruling out, but acute causes. And I told her the return precautions and let her go. And as she was walking out, she said, "Don't you forget that it's mind over matter." And that sat with me for a little bit because, as medical students, we learn about the placebo and the nocebo effects. It's a well
Can
documented
you
phenomenon.
can you talk